now with the emergence of the television and other media outlets, I think it's prudent that we continue working with media houses. And I can attest to this thing. I've joined this directorate in 2015. That was almost during the time of Ebola. And we all know the contribution you've made. We've been sharing information with you, and you've actually disseminated most of those messages to the general population. And it was very useful in such a way that we didn't even have a single case of Ebola. Similarly, like the outbreak of COVID-19 also, we've seen how much you've been doing. So similarly for this case also, that's why we found it necessary to have you on board so that you help us to disseminate some of this basic information to the general population. Because the population, the community, they matter very well in this. The more people the more we know about the problem, the better and easier for the problem to be solved. So that's why it's important we come on board and we work collectively and support each other in ensuring that this is contained. So we actually appreciate and we look forward to working with you. Let me also recognize the presence of WHO Health Promotion Specialist, Mr. Kasama, with his colleague Azizi is here around. She has just stepped out. We also have a representative from Medicine Control Agency, Mr. Tijan Yalo, and Mr. Lami Sambu will do a short presentation on the situation of Acute. So the whole idea is to update you, to provide you with some of the basic information and also the latest information about Acute, so that you in turn can also share this thing with the general population.
So when they brought the medications to the team, we sent them to Ghana for analysis. Out of the 9 products that were sent there, promethazine happened to contain ethylene and diethylene glycol. So based on that results, we sample other syrups. But we bear in mind, we know that promethazine that have the ethylene and diethylene glycol was manufactured by Medium Pharmaceuticals. So we collected all the syrup samples manufactured by Medium Pharmaceuticals just to subject them to see whether they are all having those contaminated residual solvent. So when we send the products to Switzerland and France, we realized 3 cough syrups, including the promethazine, have this ethylene and diethylene glycol. So immediately, MCA engaged the wholesaler, and the party recalled all the medications to the various retail outlets, which is the pharmacy outlets and drugstores. Then the ministry also engaged on household recall to all the various semi-regions, which MCA are collating to know exact the number that we have recalled from all the various regions. Another thing that we also alluded to the team, in science is evidence-based, and we cannot just narrow our angle only on medications, because we were in the rainy seasons, and we know for the past 15 to 20 years, Gambia experienced the highest rainfall in this season. Because we realized 95% of the kids that died are from flooded areas. So some water sample, urine, blood samples were collected from kids that were showing the same signs and symptoms. So after analyzing those samples, 90 to 95% of those samples shows the presence of 6 different bacteria species and 3 different virus species. We also collected 3 samples from kids that are having the AKI. And out of those 3 kids, when we analyze their stool sample, all of them have bacteria present in their stool. But as we are talking, I am part of the task force that is investigating the causes of this AKI. Just to make it clear to the general public, we haven't concluded yet it is the medicine that causes it or it is these microorganisms that have caused it. We're working on causality assessment as we speak now. The kids that were subjected to medications, we're trying to establish each of the kids which medication they took. And as I made it clear, good number of kids died without taking any medications. Good number of kids died without taking any medication. Other kids, they died, the medication that they took, we have tested them and they are good. So we are working on that, but just to make it clear here, World Bank have pledged to establish a food and a medicine quality control lab. Because the main challenge of the country here, we don't have a quality control lab to ascertain any medicine that is coming into this country. So that's why when this medication came in, Medicines Control Agency is not having a lab to subject this product into analysis to detect the presence of these residual solvent. But with the help of World Bank now, preliminary work have already started. So we hope this AKI will never repeat in the country. So with the help of WHO too, they did their best to help and fund for us to send medicine samples into various countries. As I mentioned, highlighted earlier on, Ghana, Switzerland, and France. And as we speak now, we have tested 39 products, syrups, 39 products. And out of these 39, it's only 4 products that is contaminated. So on that note, the message for MCA here is if anyone is taking any medication, kindly go to a health facility and seek for medical advice first. And the rest, my colleague from health promotion will buttress on that. Thank you very much.
So we are also doing pharmacovigilance. This is actually coordinated by MCA to ensure that any medicine that is taken by these kids or children at the hospital, especially those on admission, are recorded to know which brands can cause the AKI. So we are also doing case control studies. Case control studies, we have 2 groups. The groups that are already affected with the condition, and those that are not affected, we will observe them and come up with conclusions. Also, we've sent a lot of medicine samples through the MCA to abroad. We don't want to take a chance. We want to test all medicines to ensure their safety. Once these results are found, we will do a regular press briefing to ensure that our people are informed. What are the roles of the individuals? Individuals that are in this house, in this room here, and those that will be getting this message either on the radio or TV or on the print media or social media. You are the ambassadors of the AKI messages. Not everybody will have access to social media or to the media. We have people in our homes, in our meetings, family gatherings, family meetings, naming ceremonies. Wherever you go to, let us spread the message so that everybody will get it. These 70 children that died is very unfortunate. They could have been scientists in the country. They could have been great people. They could have changed this nation. So anything that will prevent such to happen again, or anything that we can use to curtail the impact of this outbreak, it will really be helpful. So if you have any further questions about AKI, especially to the public, you may always call the 1025 and somebody will be there to help you answer your questions. If your child is sick with any of these symptoms and signs that we mentioned, report to the nearest health center or call 1025. If you see any pharmacy that is selling medicines from many pharmaceuticals, you can always call 1025 or even contact the MCA. I think MCA has a free line. So Tijan will direct on that so that you can call them and they will send their teams to ensure that these medicines are not being sold by anybody. Thank you so much for your wonderful attention.
Thank you very much, Mr. Sam. I think the presentation is clear. Now, without wasting any more time, we open the floor for any possible questions, and then we try to clarify. Yes, brother.
Thank you. My name is Uncle Jacob. I work for GW. And WDR. Sir, you mentioned that some of the kids actually died without consuming the drug, and some of them also died who consume drugs that are used to safe. I just wanted to understand what would have led to their deaths. What would have
I know.
led to their
We're
deaths
often
if they actually died
disconnected.
without, if our kids are dying without consuming these drugs, and also if they die even after consuming drugs that are used to safe, that are safe to use rather.
Thank you very much for that question. As thank you very much for that important question. As I stated earlier on, that science is evidence-based. We just don't have to jump into speculations and conclude. So I also made it clear, no parents will subject their kids to any medication if they are not having any underlying condition. If your kid is not having any problem, will you give them medication? No. Right? But as per the evidence we have so far, good number of kids died, they didn't take any medication. Also, a good number of kids died. The medication they took, we have tested them and they are okay. So, meaning they already have an underlying condition. And obviously, as Lami stated, if you are not urinating, any chemical that you are taking is accumulating in your kidney. So there is something in public health that we call confounder. It might not be the underlying cause of the disease, but it can catalyze to the death of that person. In chemistry, you call it a catalyst. It speeds up that reaction. In kinetics, we call it synergism. It might not be the underlying cause, but the moment you take it, you are worsening it. Obviously, if chemicals are accumulating in your kidney, as he said, it will damage your different organs, as he was highlighting on swallowing of some of the limbs and so on and so forth. But they say it could be a possible link. It could be. They didn't say it is the cause or it is the link. Thank you.
Okay.
Well, Mr. Jallo, in light of what you have said, it seems that Maiden pharmaceutical can be absolved from any wrongdoing. You agree? If the number of deaths we register in the Gambia are not tied to the four cough syrup that have been flagged by WHO. So Maiden pharmaceutical, their product is still.
Thank you very much for that, whether a question or whether you want a clarification. But as when it comes to pharmaceuticals, right, even if one patient take a medication and died with that medication, the manufacturer is liable to that. But because that product is contaminated and it is the company that manufacture it, so the company is liable even if it is one death. The moment that product is having this residual solvent that fall above the acceptable criteria limit, even if one patient take it and die, the company is liable to it. Thank you.
Yes.
quality lab that is that Gambia don't have that facility for the testing of medications that are being imported to this country. Really, or whether the ministry have any plan to create a quality lab where at least such medications should be tested rather than depending on the outside world. Anything that really comes to health because that is so sensitive, then it is difficult for us to be keeping on waiting for results to be coming from outside. Because the ministry have any plan to create such a lab, and the second concern is that after doing this, after all these steps were reported, were there any plans to call on the victims, their parents, to counsel them so that at least they could have, take the patients rather than all the talks that have been, people have been hearing from, sometimes directly from parents who have been affected. Have the ministry or department done any plans to counsel these parents?
Thank you very much. The first question is pertaining to the National Quality Control Lab, whether the ministry have any plan. But maybe it skipped you. In my presentation, I said World Bank have already pledged to establish a food and a national medicine quality control lab. And preliminary work have already started as we speak now. But since independence up to date, which is over 57 years old, there is no medicines quality control lab in the country. But thanks to World Bank that they are supporting the ministry to establish that. And the other question is pertaining to whether the ministry have been engaging the grief families. Yes, the ministry have been engaging the grief families. So we have been calling them, as we said, we are establishing the causality because some of these kids were subjected to other medication prior coming to the health facilities. And we can only get those information from these families. And we have been talking to them. The ministry have been counseling them. And even an anthropologist from CDC in US came down and went around with some public health officers to those families and engage them. So the ministry have been working hand in hand with them because the whole country is mourning. And what happened to this family, we are all potential victims. We could have been all potential victims, including our kids, our relatives, our families. Because a medicine that comes in, that we are not concluding it is the cost. Because we are all exposed to the same medicines. Your kid, my kid, your kid will also be a potential victim. But for the time being, as scientific facts, we haven't concluded yet. As we all know, good number died without taking medication. Other died, the medication they took, we have subjected them to analysis, and they are saved. Thank you.
Yes. Mr. Jallo, did MCA and the ministry in particular did any effort for mechanism to put in place to make sure medical products from this Indian company and only in the country are put for achieve the outcome of the investigation?
Thank you very much. As I stated earlier on, the moment we had this call when they engaged MCA, the first communication we make and the ministry was to suspend the sales of all paracetamol and promethazine medication. And from the medication that they brought to us from the hospital, when we subjected them to analysis in Ghana, we realized the promethazine was having the ethylene and diethylene glycol. With immediate effect, we engaged the distributor to suspend the sales of all the syrups from that median company with immediate effect.
Only the syrups.
At that time, because science is evidence-based, as I stated, you cannot just jump into speculation. We engaged them to suspend the sales of all those syrups because those contaminants, the residual solvent, can only be in a syrup, not in a tablet form. So that's how we sample. The MCA sent some of their inspectors to the importer and we sampled all the syrups that were manufactured by Median and we subjected them to analysis. But while we were waiting for the results, we suspend the sales of all those medications from Median and other companies. And as we speak, I told you we have tested 39 products. So out of that 39, it's only these 4 products that are contaminated. But MCA will communicate with the general public the products that we have tested and they are safe to be used. Thank you.
So I heard you right earlier. You said there are kids who died. They took medication for this kid.
Can hear you. Speak louder, please.
I mean, if I heard you earlier, you said there are kids who died, but the medication they took was good. That is what your investigation showed. So I am interested in knowing for which company rather, produce those medications, if we have an idea. And also, you are responsible for testing medicines at UCA, right?
Come again?
Are you responsible for testing medicines at UCA?
Who?
You.
Me?
Yes.
Just ask, then I will respond. Maybe it's better than.
No, but do you work under the unit that tests medicines at UCA?
Are you done, please? So that I will respond to all of them.
I know we do not have a medicines quality control lab, which is a challenge, we all know.
Mm-hmm.
But what I'm interested in knowing is how do we test medicines at UCA?
Thank you very much. As I made it clear here, if you don't have the equipment and you don't have the lab, no matter how competent and efficient you are, you won't be able to analyze the medicines. Because looking at a water bottle, the pH is supposed to be 7, right? But if you don't use a conductimeter to test that water, you won't know whether the pH is 7 or it's around 6.5, 6.8, or 6.9. So no matter how MCA have competent personnel to do the work effectively and efficiently, if you don't have the lab and the equipment, we won't be able to analyze any product. So as we speak now, we are not analyzing any medication in the country. The only thing MCA have right now as we speak is few test kits that were purchased and sent to us by Wahoo, and that one is just to do qualitative analysis. Qualitative analysis. You have quantitative and qualitative. Quantitative is to come up with values, numbers. Qualitative, for an example, let's use paracetamol as an example, to check whether that product claim paracetamol, whether paracetamol is there, yes or no. That's the qualitative part. But to go further, to check whether that 500 milligram, for an example, in a tablet of paracetamol, whether that 500 is there, yes or no, we don't have the equipment yet. But we have competent people to do it. And your question, whether I work under the unit of, yes, I specialize on different areas, because I did public health as well. Because the main purpose of this health system is to safeguard the public. That's why we call it medical team. People of different expertise that works together to see a patient going out from a health facility smiling. But I'm also into quality analysis of products. But as we speak now, we don't have the lab. No matter how competent and efficient in that, if you don't have the lab, that competency is just there until we have the lab. Thank you.
Say like those who died without taking the what are those products? Where would they?
No, but as I stated, you know, the country imports products from all over the world. There are products that are coming from the developed world, in the United States, in Europe, Asia, and within the sub-region. So right now, I cannot just fish out a single company and mention it. But what matters, the product have been tested and they are good. They are not contaminated. But these products are from all these regions. Thank you.
If it is